Good morning. My name is Marie Moe. I serve as the Chief Communications Officer of the North Dakota Department of Health. I want to thank you for joining us here today for this flu kickoff event. To get us started, I would like to welcome North Dakota Governor Doug Burgum.
Morning, North Dakota. Thank you, Marie. Great to be with you, and thanks everybody for joining us today. Let me start out with gratitude for all of you that are doing your part to ensure the health and safety of the citizens in North Dakota, your family, your friends, and your community. And that certainly includes my gratitude for the North Dakota Department of Health for the work that they do every day and continue to do to help empower people, improve lives, and inspire success, and to make sure that we are doing everything we can to keep our families and communities and our schools safe. And I also want to thank all the local public health units across the state who've been working so diligently every year, but especially the last 18 months, and all the private health providers that continue to fight on the front lines of the health challenges that we're working through right now. Today, we're here to talk about flu and the flu shot as we head into flu season. We've got with us today Dr. Nazar Wiebe, North Dakota State Health Officer. Northland Community Clinic from here in Bismarck is going to be administering some vaccines, including myself. For some, I'm sure the highlight will be watching me get a shot. Levi Schlosser, the Influenza Surveillance Coordinator with North Dakota Department of Health. Dr. David Field, who's a family practice physician at Sanford Health. And then Molly Hall, the Immunization Program Director, will moderate the questions at the end of this program. I think we all know by now that there's a strong theme that we've been focusing on, which is that protecting your own health helps protect others, and it also helps if we can reduce the burden, which sometimes can be significant on our healthcare system from respiratory illnesses like the flu or like COVID. If we can do that, it's important to protect the vulnerable populations from risk of severe illness, but it's also important that when we protect them, then we are protecting the healthcare system and hospital capacity and other critical infrastructure, because you don't know when you or a loved one might find yourself in need of emergency care, whether it's for stroke or heart attack or a traumatic situation like a car accident or a sports injury. But again, we want to make sure that we protect that healthcare system. And vaccines are one of the safest and easiest ways to ensure that. They're one of the miracles that have helped not just our nation, but the world achieve things that had never been achieved in the history of humankind. And we need to be sometimes perhaps reminded of that. I was looking at some data recently, as people know that I like to do. Diphtheria, which is something that's basically been eliminated from our lives during the early parts of the 20th century, the 1900s, was killing about 21,000 people a year. Hepatitis A, 117,000 people a year. Hepatitis B, 66,000. Those numbers have all been dramatically reduced. But the ones that we know the words, but we don't know the disease. Those of us that grew up in an era where our own kids were able to be vaccinated from things like the measles and the mumps. It's hard to think about a time when the measles used to kill 530,000 people a year, and now that number is almost zero. Mumps, 162,000 people a year. Pertussis, which again, people maybe aren't even familiar with, 200,000 people a year. So vaccines have been something that has made an incredible impact on the healthcare. And for those fiscal conservatives like myself, the other amazing thing about a vaccine is vaccines are often the lowest cost and simplest way to reduce healthcare costs for families, for companies, and for individuals. And I know that that's been a debate we've been discussing the last 10 years, is how healthcare is delivered in the country and the cost of that. And so again, vaccines need to be understood that it's been proven over history that vaccines are the thing that help improve health in families and communities, and they also lower the cost of healthcare like no other invention really at all ever in medicine. So I'm a believer in vaccines and the power of vaccines, and and what they can do to help protect our families and our communities. And long before COVID, the flu vaccine was something that every fall there was always campaigns. During the time I've been in office, I've been standing up and participating in flu vaccine conferences like this one as the safest and easiest way to present yourself and your loved ones from getting influenza. And as you often heard during the pandemic, oh, COVID, it's no different or no worse than the flu. There are big differences between this, and I think one of the things that is specifically different is that the impact that flu has on children that are age 5 and under. 2 years ago, pre-COVID at this conference, it was difficult to get through because I was sharing the stage with a young mother here from the Dakotas who had lost their 2-year-old daughter to the flu after less than a week of illness. And that kind of a tragedy, she was on the stage sharing it because didn't want any other mothers or families or grandparents to go through that, and was sharing her story. And so we have plenty of reasons why, but the importance of public health for me was impressed on a very early age through my family. My grandfather, Dr. Burton Kane Kilbourne, ended up in Fargo in the 1920s as the medical officer for, at the time, was one of only 5 public health demonstration sites in the nation. It was an effort to try to prove with data and clinically that if a community adopted certain health practices, including vaccinations, that they could end up with better health outcomes as a community than other communities. And the data certainly proved that. That care about community health was passed on to my mother. Many people might still remember my mother, Catherine Kilbourne Burgum, who served as the first president of the St. Luke's Hospital Auxiliary in Fargo, and then also served 2 terms as the state president of the North Dakota Hospital Auxiliary Association. And well, my grandfather was in this position, and my family was involved in healthcare. It was my uncle, James Howard Kilbourne, that was the Fargo's first polio victim. And while it didn't kill him, when he went from a healthy, athletic 16-year-old to someone who was paralyzed from the waist down and dealt with that for the entire rest of his life, and of course, I had a chance to watch my uncle struggle with polio. And so it was with incredible joy when we were kids that the polio vaccine was able to be delivered to be children. And I'd say joy for my mother, because I don't think at a young age when we were receiving that, we could understand how relieved she was knowing that none of us would ever have to live a life like Uncle Howard did. The flu vaccine, again, while challenging because of how the flu mutates and moves around our planet, they are always trying to make a flu vaccine that anticipates the flu variants that will be coming in the following year. The new advances in flu vaccine, where 3 and 4 sometimes strains of flu can be included in the same shot, are strong advances. And so, while the flu vaccine not as highly effective as the COVID vaccines have been in terms of percentages, they still prevent millions and millions of illnesses in flu-related doctor visits, and they do save lives, particularly of those that are vulnerable, including young children. So those are the reasons why, again, over my lifetime, it's data-driven, it's proven, it's in communities. I understand why these work, and it's why I'm here today to get my flu shot, and excited to do that. And so with that, I want to turn it over now to the next to Dr. Wiebe, who leads the North Dakota Department of Health, to say a few words. Dr. Wiebe?
Thank you, Governor. Good morning, everyone. I would like first to express my gratitude to Governor Burgum and to all healthcare workers and public healthcare team members for all the work that they do every single day in service of the citizens of North Dakota. Influenza is a common respiratory disease that is spread through cough and sneeze, shared saliva, and the touching of contaminated surfaces. The severity of influenza can be anywhere from mild to deadly. The influenza virus does not cause the stomach flu, so influenza vaccine will not protect you against gastrointestinal illnesses. Influenza and COVID-19 have similar symptoms, so it will be difficult to know which illness you have. Both of them have fever, cough, runny nose, muscle aches, and difficulty breathing. Each year, more than 50% of North Dakotans choose to receive the influenza vaccine. This year, getting protection from influenza takes an increased importance because influenza, COVID-19, rhinovirus, and other respiratory illnesses like RSV are all circulating in our communities at the same time. Everyone older than 6 months of age should get a vaccine for influenza. Special attention should be paid to those who are at an increased risk for serious health outcomes from influenza. That includes children younger than age 5, adults over 65 years of age, those with compromised immune systems or chronic health conditions, pregnant women, and American Indians or Alaskan Natives. Individuals who are in close contact with those who are at high risk for complications should also be vaccinated. This includes healthcare workers, long-term care employees, and family members. Children between the ages of 6 months and 8 years need 2 doses of influenza vaccine 1 month apart if it is their first time getting the flu vaccine. People should be vaccinated this fall before Halloween if possible. However, it is never too late to get vaccinated, but the earlier, the better. It is important to get vaccinated early before flu starts circulating among our communities because the vaccine takes 2 weeks to become effective. There is no recommended spacing between COVID infection and getting the flu vaccine. But it is important that if you have COVID, you'd better stay 10 days of isolation period before you go and seek flu vaccine. People can receive flu vaccines at the same time as other vaccines, including COVID-19 vaccine. Flu vaccines are offered in many places, in doctors' offices, clinics, local health departments, pharmacies, college health centers, as well as by many employers, and even in some schools. Some healthcare providers are utilizing drive-through flu vaccine clinics. If you are trying to find a location where you can get your flu vaccine, you can go to vaccines.gov or to ndvax.org. There are various types of flu vaccine available. There is nasal and injectables. Talk to your healthcare providers to decide which one would be the best for you. The flu vaccine is the safest and easiest way to prevent yourself and your loved ones from getting the flu. It reduces your risk of catching or spreading the flu, and it dramatically reduces the risk of hospitalization and serious health outcomes associated with influenza. You should not only get the flu shot for yourself, but also seek the flu shot for everyone that you love. When more people get vaccinated against the flu, less flu can spread throughout the community. By choosing to be vaccinated, you will not only be protecting yourself, but you will be protecting all those who are around you and those whom you love. At this time, I would like to invite Jennifer Surisag, a registered nurse from Northland Community Clinic, who will be administering influenza vaccines for us today. And to tell you a little bit about Northland Health Centers, it is the federally qualified health center that is committed to delivering patient-centered, accessible, quality-driven, medical, dental, and behavioral health care to all generations to strengthen the health and the health status of those they serve. So, Jennifer, I invite you, and time to get flu vaccine. Jennifer and Leslie, please come up and help us with the flu vaccines. Hello.
Preference on what arms, sitting or standing? Do you have a preference? Left arm, maybe.
I have to have you sign. Give us permission. Make sure I'm not feeling sick today.
No?
So no problem.
Yes.
We can have a seat. Yes. It's your first high dose flu shot today. Your first high dose flu shot.
The high dose, yeah, absolutely.
Yes.
yeah.
Can I hold your Band-Aid for
First
me?
time I've been 65, so.
There you go. Well done.
The crowd goes wild. Thank you, Jennifer.
You bet.
Lindsay was signing.
My
the
time?
crowd going wild.
Work? Sure.
Ready. Okay, thank you.
Dr. Field,
We'll do
do you have a preference? Which arm?
Left arm, please.
Okay. We'll just take turns.
There you go.
Okay. Thank you. Thank you. Go.
Sure, okay.
Done.
Did you feel it? Thank you. Very good.
Oh, good.
Thank you so much.
Give her a chance to get it off after Lindsay, I think.
You getting one?
And this is after
Oh,
this.
I guess. I do not first. I did my NIH check.
Oh, no problem.
Okay, thank you, Jennifer. Thank you, Leslie. And thank you, Northland Community Clinic, for being here today to administer our influenza vaccines. At this time, I would like to invite Molly Howell, who is the Immunization Director and Assistant Section Chief of Disease Control in the North Dakota Department of Health, and she will share some information about the flu vaccine. Molly?
Hi, good morning, everyone.
I am honored to be here today, and I'm going to provide just a little background about influenza in North Dakota. Influenza is a reportable disease in North Dakota, but only people with positive influenza laboratory tests get reported to the North Dakota Department of Health. Last year, we had a very low influenza year where we only saw 244 laboratory confirmed cases of flu. However, despite high levels of testing, it was unusually low year, both in North Dakota and the rest of the U.S. This is likely due to measures taken to prevent COVID-19 last year, including wearing face masks, staying home, hand washing, school closures, reduced travel, increased ventilation, and physical distancing. That likely had a significant impact on reducing the incidence of flu in the United States and worldwide. Flu vaccination could have also contributed to reduce flu illness last year. We unfortunately likely will not have estimates of flu vaccine effectiveness for last season, and that's because there were so few flu cases in the United States. However, there was a higher or a record number of doses distributed in the United States with 193.8 million doses last flu season. The low level of flu activity during this past season contributed to dramatically fewer flu illnesses, hospitalizations, and deaths compared to previous flu seasons. For comparison, during the last 3 seasons before the COVID pandemic, cumulative case counts for this season averaged between 7,000 and 12,000 laboratory confirmed cases of influenza in North Dakota. And just as a reminder, last year we only had 244. In terms of hospitalizations, the cumulative rate of laboratory-confirmed flu-associated hospitalizations was the lowest on record since we started collecting data regarding influenza in 2005. Last year, we only had 21 flu-related hospitalizations. In the past 3 flu seasons, however, we've averaged between 300 and 370 flu-related hospitalizations. Each year in North Dakota, we generally average about 1,344 flu and pneumonia-associated deaths in North Dakota. Flu season typically runs between October and May, with most cases traditionally occurring in January to March, but this can be very unpredictable, and we don't really know what to expect this flu season because last year was such an unpredictable flu season. We are seeing high levels of RSV right now, and that could potentially mean flu season might be earlier this year. Currently, we are seeing sporadic activity of flu cases in North Dakota, which is normal for this time of year. Our numbers for flu cases are updated on our website at www.ndflu.com. And again, there are several ways people can protect themselves from catching or spreading influenza. Of course, number 1 is vaccination, but also masking does play an important role in preventing the flu. Getting tested early if you have symptoms, hand washing, staying home when you're sick, covering your coughs and sneezes, and then for flu, there are antivirals that can be prescribed to shorten the duration or the severity of illness. The flu vaccine reduces infections and clinical severity of disease by preventing the virus from entering and damaging cells, especially those in the lungs. It is the best and easiest way to have to keep people from severe disease and death due to influenza. Next, I would like to invite Dr. David Field, a family practice physician at Sanford Health, to share a few words about flu and COVID. Dr. Field?
Thank you, Molly. My name is David Field. I'm a family practice doc at Sanford for the last 26 years. And for a great deal of that time, I've also been a public health officer through Custer Health, which is, again, as Governor Burgum said, the public health officers and staff are doing a phenomenal job to try to help us in this COVID time and in the future for influenza time. We've heard a lot of great information about why everybody should get a flu shot. And as a practicing primary care doctor, I want to give you some additional important information and include some day-to-day experiences that I think will continue to show why it's important to get your flu shot so we in the state of North Dakota can remain healthy. Flu vaccination has a long and successful history in preventing serious illness and hospitalization. Flu vaccination first started in the 30s, and mass vaccination started after the World War II in 1945. It's now evolved even further, and so we're now having a four-pronged immunization with 2 influenza A's and 2 influenza B's. I'm going to take this off. I've been so used to wearing a mask during COVID, it's just second nature for me. We've heard before that kids should start to be immunized at the age of 6 months. And there's also a flu mist that's available starting at the age of 2. It's also very effective. And personally, in my office this year, we've given 6-month-old the shot. And a couple of 3 years ago, I've given a 104-year-old lady an influenza immunization. Flu shots should be completed by Halloween, as stated by Dr. Wiebe. And again, it's appropriate to continue to keep us in good shape to be healthful. COVID shots and flu shots can be given at the same time, and we encourage those. COVID and influenza have similar symptoms, so it's important to check with your primary care provider for testing and treatment if those symptoms happen. Again, check with your primary care provider. Very important. Immunizations will help prevent this illness from affecting lives. It's highly effective at preventing serious illness, hospitalization, and death. The vulnerable groups, as stated before, include healthcare workers, those over the age of 65, those with immunocompromising diseases, our native population, and individuals in congregate living situations. Flu vaccine has been very effective at preventing hospitalizations by as much as 40% compared to non-vaccinated individuals. In the high-risk groups, those areas or diabetics can have their hospitalization rates reduced by over 80%, COPD by 50%. Pregnancy, something we really don't think about a lot of times in the immunization for flu, can be reduced, or the symptoms of flu illness can be reduced by 50% and hospitalization by 40%. Even healthy folks without concurrent illness can have a reduction of 25% of hospitalization rate. At this point, pregnancy vaccination should start in the last trimester. And again, check with the OB or family physician for consultations on when this should occur and how it can occur. The real important thing at this time is we really truly need to reduce our healthcare burden. I was on call last weekend, and COVID has really exhausted our healthcare system. Our nurses and our aides, even at the nursing homes, there's been a lot of truly wonderful people that are giving their all to try to keep us healthy here in the state. Having one person not get hospitalized, having one not having that critical conversation where you have to talk about serious illness, ventilators, and all those things is so helpful for us. We really want to help everybody in our state, but it is very tiring after this year and a half of COVID, but it doesn't stop us from trying to continue to do our job every day. We have Jeff Sather from Minot, a physician at Trinity, told this story, and it kind of relates on why we need to be really on top of this flu season. There's an individual who needed an ICU bed in Sidney, Montana, and the normal healthcare transportation or follow-up would be to Minot. The doctor in Sidney called in North Dakota, called in South Dakota, called in Wyoming, called in Montana, called in Idaho. That individual is now in an ICU in Seattle, Washington. It's just for the COVID person or the COVID need. How about if that's just a regular pneumonia or a cardiac problem or a bowel surgery? What if we don't have access? We're striving hard to make sure that never happens. But we just need everybody to help us do our job in the best way possible. In North Dakota, we will do anything for our neighbor if we ask. Please save a life. Please get your flu shot. Please call your primary care provider, your public health officer, your public health area. Please get your shot, and we'll all be healthier for it. Thank you very much.
Thank you, Dr. Field. And to all of our speakers today, I think we have time for some questions, so I'll open it up for any questions that anyone might have. Michelle?
Hi. Can you talk a little bit more about how pandemic mitigation strategies have or curbed COVID last year, and how there's a reduction in those this year, and how that could affect hospitals?
Yeah, that's a great question. So as I said, last year we had a very mild flu season, under 300 influenza cases reported to the North Dakota Department of Health, compared with a typical flu season, which is between 7,000 and 12,000 influenza cases. And that's likely due to the fact that we weren't traveling. We had school closures in the fall last year. When people were sick, they were more likely to stay home. We had more universal masking last year. And then, of course, we had a lot more hand washing, just people paying more close attention to their health. And so when we're going into this year, I think we all can see there is more travel happening. There's definitely less masking than what we had last year. Every school is in-person learning in North Dakota. People aren't working from home as much. They're going into the office more and having more in-person meetings. And so we never know with each flu season how to predict what's going to happen, but we just have concerns that we are going to see more flu this year, and we don't want to have flu cases on top of COVID cases stretching our hospital capacity. And so that's why it's important to be vaccinated, and then also consider other mitigation like masking, or if you're comfortable with that, and staying home when you're sick. Definitely people need to stay home when you're sick. I think people need to think about the flu and COVID have very similar symptoms. And so when you get a cough or you have a fever, you're not going to know if you have influenza or if you had COVID. And so you're likely going to have to go into an urgent care, go into an ER, see your doctor or pediatrician. And that's going to tax our healthcare system that's already heavily focused on caring for COVID patients. So the more people that are vaccinated for influenza will reduce the amount of influenza and hopefully reduce the burden on our healthcare system this fall and winter. No other questions? No? Well, it doesn't look like we have any other questions today. I just wanted to thank all of our speakers, Governor Burgum, Dr. Wiebe, and Dr. Field for being here. And I want to thank Northland Health for administering flu shots today. And if you haven't already done so, please schedule a time to get your flu shot. And also, if you haven't done so, don't forget about your COVID vaccine or potentially your COVID booster. Thank you, everyone.